Most people think losing a tooth just leaves a gap in their smile. But what if I told you that missing a single tooth is actually changing the shape of your whole face right now? I'm Dr. Annoni, a restorative doctor at Nuvia Dental Implant Center. And in the next few minutes, I'm going to show you what's happening inside your jaw that most dentists never explain. And why waiting even a few months could make it irreversible. Point 1. Face changes. Here's what's really happening, and why this might shock you. When you lose a tooth, your face literally starts caving in. Look at this. See how the lower face height shrinks? That's not just an x-ray problem, that's your actual face changing shapes. The lips start to fold inward and the cheeks start to hollow out. You get that aged, sunken look that makes people look 10 to 15 years older than they actually are. This isn't just cosmetic, it's structural. Your teeth are literally the scaffolding that holds up your face. Remove that support and gravity takes over. That's just what you can see on the surface. What's happening underneath is even worse. Point 2. Bone loss process. Here's the part that will blow your mind. And it's something most people never learn until it's too late. Every time you bite down, your tooth root sends signals through your jawbone. These signals tell your body, hey, we need this bone. Keep it strong, keep it healthy. But the moment that tooth is gone, those signals stop. And your body is incredibly efficient. It thinks, well, we don't need this bone anymore. And it starts to reabsorb it. Within the first year, you can lose up to 25% of your bone width. By year 5, sometimes there's not even enough bone to hold a denture, let alone an implant. Think of it like this. If you broke your arm and you never used it again, those muscles would weaken, waste away, right? Same thing happens with your jawbone. Use it or lose it. And if you think that's concerning, wait until you see what this does to your other teeth. Point 3. Movement and bite issues. Nature hates empty spaces, and your teeth are no exception. When you lose a tooth, the neighboring teeth start to drift and tilt towards that empty space. The tooth above it starts to drop down, looking for something to bite against. Now your bite is thrown off. This creates a domino effect. More teeth become loose, more teeth need work, and before you know it, you're looking at losing multiple teeth instead of just one. I see this every day. Patients who come in saying, it started with just one tooth and now look at me. But here's what really concerns me as a doctor. This isn't just about your mouth. Point 4. Health implications. Missing teeth don't just affect your smile. They affect your entire body. When your bite changes and teeth shift, it becomes harder to clean properly. Bacteria builds up, gums become inflamed, and that inflammation does not stay in your mouth. It enters your bloodstream. Studies show that people with missing teeth have a 30% higher risk of heart disease. They're more likely to develop diabetes complications. Even dementia has been linked to tooth loss. Plus, when you can't chew properly, your nutrition suffers. You start avoiding healthy foods like fruits or vegetables because they're too hard to eat. Your whole quality of life changes. So, here's the million-dollar question. How do you stop this process and get your life back? Most people think that they have to choose between dentures that slip and slide or a long, drawn-out implant process that takes months and months. Even what other places call teeth in a day usually means that you're stuck with a temporary denture for up to 10 months while you wait for your permanent ones. But what if I told you that there is a third option that most people don't even know exists? Here at Nuvia, we've completely revolutionized this process. Instead of giving you temporary teeth and making you wait, we give you your permanent, custom-crafted final teeth in just 24 hours. Here's how we do it. After we place your implants, we use highly accurate digital mapping technology to scan your mouth. Then our in-house lab team works through the night, milling your permanent zirconia teeth so that they're ready the very next day. We're not talking about plastic, temporary teeth. We're talking about permanent zirconia teeth that are stronger than your natural teeth ever were. Think about it. In 24 hours, you go from losing bone, having your face collapse, and dealing with all of these health issues to having a permanent solution that actually stimulates your jawbone and keeps it healthy. These aren't just replacement teeth. They are bone savers. Every time you bite down, you're sending those crucial signals to your jawbone, telling it to stay strong and healthy. Your face gets its support back. Your bite is restored. You can eat what you want. And most importantly, you stop the bone loss immediately. While other people are waiting months with uncomfortable temporaries or worrying about their dentures falling out at dinner, you're already living your life again. No multiple appointments, no months of waiting, no temporary teeth that just don't fit right or break. Just permanent, beautiful, functional teeth in 24 hours.
I went back within 24 hours of the surgery and they put these in. Put those in my mouth and I left. and I was able to eat. That was one of the things that I liked. I didn't have to make several appointments or wait without teeth because we've done that for way too long.
When you think about everything we just discussed, the bone loss, the facial changes, the health risks, the impact on your quality of life, doesn't it make sense to choose the solution that fixes all of these problems immediately rather than prolonging them for months? Now, I know what you're thinking. This sounds expensive and complicated. That's exactly why we created our free dental implant cost and information guide. It breaks down everything from the different replacement options that I just mentioned to you to what you can expect to invest, and most importantly, how to avoid these problems before they get worse. You can grab that link in the description. No runaround, just the facts that you need to make an informed decision. Look, I see patients every day say, I wish I had known this sooner. The good news, if you're watching this now, you're not too late. But the clock is ticking. Every day you wait, you lose more bone, or your face changes more, or your options become more limited. The patients you just saw, they took action. They got their lives back and their confidence back. Most importantly, they stopped the damage before it was irreversible. But look, I want to be completely transparent with you. While this solution works amazingly well, for most people, there are 5 reasons why I wouldn't recommend getting dental implants. Dr. Heimer walks through each one of these in this video because the last thing that we want is for you to make a decision that isn't right for your specific needs and situation.